industry colleagues, good evening and welcome to another new episode of the Quest for Excellence series brought to you by Intellectus Consulting. It is my pleasure to introduce to you our guest for today, who has been an outstanding leader, not only in the Indian pharmaceutical industry, but also now in the global pharmaceutical industry. He has spent over 4 decades with organizations such as Novartis, AstraZeneca, and now Viatris. My guest for today is Mr. Kumar Subramaniam, who is the global head for commercial biologics based out of Pittsburgh in the United States. And I look forward to this wonderful interaction with him this evening.
Hi, Shailesh.
Hi, good evening from India, and or rather good morning to you from the other side of the Atlantic.
Thank you, Shailesh. And let me first start by thanking you for inviting me, for this very interesting series, I thought, Quest for Excellence. I'm very happy to be part of this. Thank you.
Thank you so much, sir. It's our honor and privilege to have you as well on our show. Just before I logged in, I had a small intro clip of you on for our series viewers who listen and tune into this series. Is that you're probably one of the most well-known, admired, respected faces of Indian pharma industry now in the global arena, and it's really, when I look at your life and your career, it's been outstanding, and and many of the viewers and listeners, who tune into our podcast and the YouTube channel are the Gen Zers. So I don't intend to make you feel old because you're always perennially young, but most of the Gen Zers were probably not born when you started off your career in India way back in the 1980s. But I wanted them to know what it is to have a great longevity in terms of the career span, in terms of, how you build your career so successfully on certain tenets and principles, and also your life learnings, parting words of wisdom to our community. So thank you so much, Kumar, for coming on to our show. So I want to straight, dive into our conversation. And I have been to ask you this question whenever, I got the opportunity. 40 years, 4 decades, 18 diverse roles, and, 3 continents, and a career which is being punctuated by outstanding, milestones, achievements all along the way. So, and it's not easy to, have this kind of a track record. So my first question is, how does it feel when you look back, at such a lovely career which played out itself? So I thought of starting off our conversation with that question, sir. Yeah.
Thanks for all those nice words. I don't know whether I deserve, but certainly, I'm reminded of that famous song by Udit Narayan. I'm sure all of us grew up on that. Papa kehte hain, bada naam karega, beta hamara aisa kaam karega. Magar ye to koi na jane ki manzil hai kahan. Probably, my parents, my mentors, my colleagues, they all, they watch me so closely. I'm sure they must be feeling proud more than me, because I don't think anybody thought I would go all the way and for so long. And I think it's all because of the people whom I worked with. I've been influenced, I've been mentored, and I think they have been a very, very strong reason for my success. So I'm very happy that I've made some people proud, and I stay at that.
Okay. I want to ask you, when you see the career of yours, it's been a perfect example of modest beginnings in sales, then increasing roles and responsibilities in sales, then coming over to the head office in marketing. From a marketing head role, you get into a BU, P&L leadership role in Novartis. And then you move into organizations like AstraZeneca and Mylan, not only in increase, and also, first of all, in Asia Pacific, in Europe and global. So one is obviously, I cannot miss the fact that it's been a career progression of increasing roles, responsibilities, and geographies. So my question is, how much of it was planned deliberately by you that yes, I want to make my career in this way, and how much of it was actually like going with the flow? Because that would give us an idea as to how people should plan their careers, right? Yeah.
Candidly, just the flow. Because I think, as you said, 18 roles or 40 years, which means that every second or third year, I was playing a new role. So you just didn't have time to look back or worry. And sometimes I think, I was, very lucky that I didn't have much time to think too much, get lost into, worrying about what is coming next, and also not worrying about being prepared to fail. So it's just that, the number of roles, the number of challenges, I just enjoyed doing it. And it has been relentless. That's all I say. I'm enjoying it. It has kept me going. No doubt I've lost my hair and my hair has become gray at a very early stage. I've just enjoyed. I kept my smile going, and that's where it is right now.
And so if I got you right, you were a person who chose to go with the flow, right? And just embrace whatever came along your way, right? Would that be
100%? Just embrace and don't worry about failure or success. Just do it, and that was my theme. Just do it, and do it what is in your control to the best of their abilities. And I've seen that when you do, a failure or success doesn't matter. People trust you, and that trust keeps going. And I've been a beneficiary of that. Yeah. So thank you.
And it's interesting, Kumar, to hear that from a person like you who's demonstrated longevity. Because in today's context, turbulent times, new generation of people heading up businesses, a lot has been spoken about career planning. Plan your moves, plan it to the next level, gain those competencies. And suddenly you find K.S. Kumar coming as a breath of fresh air, saying, yeah, don't worry, because, look at my life example and I've gone with the flow. So for a person who is, watching you and, also being bombarded by this other aspect of career planning, how do you then weigh it out, Kumar? I mean, I know it's not a straight answer, but how would you weigh it out, and what would be your sense of perspective? I just thought of asking you that, yeah. Because people are obsessed with careers, that's the whole thing. Yeah, in India, back home, how competitive it is, right? Yeah.
Yeah, I get it. I'm not a big believer of prescriptive theories. That you can. Yeah, I know that there is a saying, you are the creator of your own destiny.
Right.
And when you can create your destiny, but that's only when you enjoy what you're doing.
Right.
So if you keep thinking that, next role it's going to be a group product manager, a marketing manager, and then you're thinking too much about it, you are lost in doing what is there on your hand. Right. I think it's very important to stay focused and do what you are being given, the role and the responsibility. Do it so well, there is no option but for them to look for you to the next role. And, organizations I've seen has fresh issues coming up all the time. And they always look at people who can do it type, who will go and find solution, who has an ability to bring the diverse thinking and make things happen. So I think that has been also my leadership style. I've never, worried about putting my young guys up front, helping them. And I've been like a servant leader, just make them do the things. Once they succeed, they will ensure that you also succeed as a leader. And I think that's the principle which I always brought in my style of working. And it has been successful so far. As they say, the leader is one where you see your subordinate becomes your peer, or he could even become your boss. But that shows that you created a culture where people had no fear, but they were capable of just doing it passionately and doing it well.
Absolutely. No, I think the first takeaway in this initial minutes of our conversation, what you've just mentioned for all of us, including me, is stay focused in the present. Don't bother about the future. So when you stay focused, you're able to deliver your best output in the present, and that makes it inevitable for you to go into the next role rather than being obsessed about when am I going to get into the next role, right? So, and the second thing so beautifully you elucidated is today a lot of diverse roles are coming up, and companies are grappling with business challenges in this current environment. So you will always get picked up if you're able to demonstrate those skills of delivering, right? And I think that's a good message. Thanks so much for that. I want to turn the clock back. I know, obviously, to look at your journey retrospectively, because I want people to understand what it is to take those learnings along the way. And you had a phenomenal career with the first organization where you worked for almost 24 long years. That's Novartis, right? And what strikes me, Kumar, is that you came from a background of sales and sales management with a very strong sales management experience. And you did that for 17 years before getting into the head office. Now, of course, today's times are different and people are very impatient in the last few decades, where they want to do a sales role and then see it as a springboard for, getting into marketing within the first 2 years or 3 years, right? Or maybe even less than 6 months to 1 year. My first question to you, how important is it, you feel, even in today's context, that sales experience is important for grounding in brand management and building your marketing skills? Does it add to your perspective, or you feel that, well, it is just an additional, because you deal with today's generation of marketeers in the global arena. So what's your take on it? I thought of asking you that.
So let me first acknowledge, I've been very lucky to be part of 3 great companies. And to start with, Novartis was like, I did my schooling in Novartis. I graduated in Novartis in commercial roles. Because in that 24 years, I did 9 roles in Novartis.
Right.
Right from a sales rep to a sales manager, in sales, marketing, from product manager to head of marketing. And then you don't forget, I was also head of training. And then I became a business unit head too. So, it was like it was a graduation in commercialization, a pharma commercialization. So, it's certainly, as they say, in the past, Unilever used to have this internship program where, one had to go through all aspects of, the customer touch. And it basically said you could connect the dots and understand the whole process of commercial execution. So the advantage you get is when you work in all those departments, which has the final impact of what we call the full commercialization, it makes you a much better, commercial person. Because when I took the role of BU head in Novartis, for me, it was not a major shift because I'd done the sales roles, I'd done the marketing. I knew what it takes to influence people. So it was an easy sort of, shift to a leadership role. So I think it is an advantage for people to do multiple roles. As they say, our great guru, M.H. Narasimhan, always used to say that there is a phase of learning and there is a phase of earning, And the phase of learning, I think one need to have an open-minded approach.
Yes.
Just what it takes to build capabilities. The more capabilities and competencies you build in your career, I think it helps you when you grow into the senior roles where you are expected to make a much bigger impact at the professional level, at a people level, and the organization level. So it really...
No, beautiful. I think you said it very beautifully, that you spend the time investing in yourself and learning those ropes and any capabilities which stand you in good stead when you head up those commercial leadership roles. Sir, I want to ask you, your long stint in sales, how did it set it up nicely for you when you got into marketing for the first time into the head office? I mean, obviously it would have. So what was those learnings that you carried forward when you took up the marketing role? I just would like to know.
Yeah. So I would like to go back a little. I was a very successful zonal manager at that time, and we had our sales head, Mr. Bhargavan. He told me, I want to move you to head office in head of training. And those days, when somebody will tell you that you have to go to training, you thought that probably you are a misfit in sales, so he's just pushing you to training. But he gave me a very good perspective. He said that, look, this is a great door opener for you to really get into the the senior leadership sort of high level work, because it then opens up many opportunities. So I can give you a door opener, but from there, how you progress in your career is within you. And so I thought it was a great, perspective on what I should be doing in the future. I took the role. But what I brought was in the training, which was typically seen as a bit of a boring role, I brought in a lot of innovation and a lot of my own experience of what training should be and how it should be imparted. I think that's what I think impressed quite a few seniors in the organization. They thought that I'm perfectly capable of taking up a marketing job as well. So they didn't give me straight away, but while I was doing a training role, I had a great boss, a great marketeer by name Ajay Kumar. He said, why don't you take as an additional responsibility launching of a global brand called Parlodel, which was bromocriptine for both Parkinson's disease as well as infertility. So it was a major challenge, a single drug in two different therapeutic areas. And he wanted me to do it as an additional role to my training role. Again, I took it up with both hands because I thought, again, it's a great, recognition that somebody was giving me a global brand, and that too, it's a great chance to go and just do it. And I think then the story of marketing started from there. So once I did that, it was one of the very well spoken launches. It had all the elements of very strong fundamentals of marketing. I must thankful to Ajay Kumar. He took me under his wing and ensured I understood the fundamentals of marketing. Plus, I also got a chance to be trained under what was then a very famous marketing program globally for Novartis called as Marketing Powerhouse. And that was a very structured marketing program which was aimed at brand building and ensuring that you understand the elements of those in your execution. So I was a beneficiary of both of this. And I think from then on, it became a big marketing career. Then on, I went on to head the entire, all the businesses marketing. I was head of marketing for some time in Novartis.
Right. My question, Kumar, is marketing has undergone a lot of transformation in the last few decades, right? It's definitely not been the same what it was in your time. And my question is, how was pharma marketing in the times when you took on that role, right, for the first time? And how, when you see today, even today in 2022, you're grappling with marketing challenges, obviously in a different context and different level. What was then, and how do you see it as compared to now? If just to throw some light on that, yeah.
I'm sure, Shailesh, you are yourself a very great marketeer because you used to look at you with a lot of admiration, especially Lantus launch, etc. The fundamentals of marketing has not changed. I think the marketing has evolved into much more structured, and there is a lot more innovation than what it used to be in the past. The pharma marketing was always looked as something very backward in terms of its, forward looking in progress. But I think things have changed a lot. It's also a fact that pharmaceutical marketing undergoes much more scrutiny. You are under very strong compliance parameters. While, it's easy to say that you could bring in all the digital elements, it may not be as easy as you would have done it for a cola drink or a chocolate. This calls for very responsible marketing, and you have to work within the boundaries. So I would say the marketing has evolved. There is a lot of modernization which has happened, and COVID has accelerated it. The digital transformation is here to stay. And we see that, the companies are also very rapidly adopting to the changes. So I see, if you ask me, the marketing has become much, much more interesting for people. And, marketing is seen as an important element in driving an organization's success. In the past, marketing was seen as a cost. There was always this debate whether is it worth spending so much of ad pro on a specific product? Is it worthwhile to put it directly in front of reps and do some kind of a CRM, etc.? But I think that has undergone a change now, because the data analytics have dramatically improved. Today, you can track the progress. There is certainly a lot more insights being generated. The market research has much more meaning. And I think analytics has played a dramatic role. So I see the impact, and I see that things will rapidly change in the coming days. And the marketeers have no option but to, get out of the status quo, right? So things will evolve, and I think your work today, what you are doing in educating marketeers, I think will have a lot more bearing. I think you need to have a good training in place. You need to challenge people to think differently, and that cannot happen by just doing day-to-day work. So it requires an outside-in challenge so that the marketeers start thinking about it.
Right, right. No, I think that's a very well summarized overview of the transformation of pharma marketing over the last couple of decades. But I have a question for you to respond in the manner that even though there has been transformation, Kumar, in marketing through addition of very value-added functions, right? As you just mentioned, data analytics, omni-channel marketing, which is the buzzword today, and it makes a lot of sense, as you said, in the COVID. Plus, customer engagement models have also more refined. But don't you think that the principles of brand building and building strong fundamental pillars of your brand will never go away, however fancy tools would come, right? So your insights generation, as you mentioned, or insights analytics, or mining, or driving decision making through hardcore data, segmenting. These are time-tested truths of brand building, and we have lived with it, and you have lived with it more than all of us. So, what's your position? You can't surrender these, right? And because the new generation of marketers may tend to get into a lot of width on the marketing piece, but even building depth is equally important on the fundamentals. So I thought of asking you, what's your position on this? Yeah.
Spot on. As I said, the fundamentals have remained same. The why, how, and what of marketing has remained the same. The new terminologies have come. As I said, I've been trained, I think, in 3 different eras of marketing. I went through marketing powerhouse in Novartis. I went through MEX, which is marketing excellence in AstraZeneca. Then I went through what is called as 5 C's in marketing when I moved into US and when I was preparing to launch a brand in US for Mylan. So, all these, the basic foundation, as you said, the fundamentals have remained the same, right? Nothing has changed. It's just that we are adding elements to make it even more robust brand planning, right? So anybody who wants to be successful in marketing, I think it's about getting the fundamentals right is most important. The process is more important. As Dhoni always said, it is about the process. I think getting that process right is the most critical one. And that remains, even today, the most relevant one.
Right. No, thanks for, making it a very forceful position, because that is a message for our community that the process will never change, and you can't, vitiate the process. You have to go through the process if you have to become a very good marketer. And thanks so much for saying that. Your journey in Novartis was so successful that at one point then you became the BU head and you built out launches. And then after a long stint, you move into AstraZeneca. And I distinctly remember that was the time when I just launched Lantus, and Lantus was taking off in 2004. And the era of hypercharge or hyper-turbo growth for our first organization in the industry, which was Astra Ideal, had now become AstraZeneca, was completely different. I mean, the growth template was different. It was a period when you, as the vice president for marketing, brought in so much of power and, and with your team and the executive leadership team into bringing global brand launches to India in form of Crestor and Celokin and Brilliant, etc. That the world was forced to sit up and take notice, right? And I remember that uninterrupted hyper growth period for almost 8-9 years, where everybody in the industry was saying, AZ is really, busting the charts, great new product launch successes, etc. So I want to spend some time here in understanding from you, whatever you can share with our audience. How did you go about building those building blocks, of success, commercialization, and why did you, and what it took to build this kind of, it's not overnight, so it doesn't come just, easily. So how is it that you did this? Is something we would love to hear, from you, Kumar. You were at it. Yeah.
AZ, 2004 was it was a wave for Indian pharma. I think Bhaskar joined AZ, and AZ was coming back to India, and there was a lot of news around the potential new launches which is coming up. And I was approached by AZ to head the marketing, and I was thinking at that time, whether I should go back to marketing. But I remember Bhaskar and Yash at that time was HR head, great HR head who really worked very closely with commercial guys. So they somehow told me that I was the best marketer on the scene at that time in India, and they wanted me to really build a massive marketing machinery for AZ. So they said, look, it's not while it could be head of marketing role, it is a very important leadership role, and we want to really become a marketing powerhouse, and nobody else can do this better than you. So I just took that. And I think the journey of marketing, and the other motivation was I was getting into new therapeutic areas. I was getting into cardiovascular, which I was very passionate. I did a lot of work even in Novartis for cardiovascular. Then I knew there was future diabetes. There was, of course, anti-infectives. There was, anesthesia, and then oncology. The number of new areas, which I thought was, again, an exciting way to build your career. So I just took it. But the best part was, I think the empowering of the whole role by Bhaskar was brilliant, because he just said that ensure that people are well trained, ensure that you embed the process of marketing, ensure that people execute the way. And he was very hands-on. I think it was all about people. It was people, it was process, and it was just that building that passion, showing that we can make things happen. We took on products where we competed with generics at half the price, but we ensured that there was a very strong cross-functionally built medical marketing programs, which was highly appreciated. And it came with a very strong, I would say, the ethical mindset of approaching to pharma in a way you could feel proud of, And I think the team embraced it, and they made it what I am today. They just enjoyed the whole process, and it was probably one of the best times in my career when I look back. Product after successful, huge growth, one of the best multinationals at that time, and all of us benefited. We had a huge impact in our career because of that.
Absolutely. Thank you so much. I don't know if this is, this would probably be a fair question to ask. I still remember Brilliant as a wonderful case study of marketing excellence, and the brilliant work done around in shaping the molecule's acceptance at the level of the interventional cardiologists in the face of low price clopidogrels, which were 1/10 of the price of Brilliant, and still able to succeed. Any takeaways for our audience in terms of what they should learn in these would be very helpful, Kumar, if you could share with us.
Yeah, I think the pre-launch phase work, I think, was brilliant. I remember just building that brand plan. We used to say that, the brand is such an important asset for an organization. It can't be just left to the brand manager. While the brand manager is there, he's the custodian of the brand. But it required a much broader input to that. And that's where we used to have, for every brand, we used to have a cross-functional team drawn from medical, marketing, finance, sales, training. Everyone used to be the contributor there. So it was like a cross-functional brand plan, which was built with a lot of rigor, a lot of challenge and support. Challenge and support, I say, it's not just throwing a problem at the people. It was about, how do we now, if that's the challenge, how do we now look at a solution together? I think that was a challenge, because it was like 6 or 7 times the price of the nearest product, and the product was not exactly successful in US. So, and that impact in the developed world has an impact in the outcome in markets like India. So we knew that, when we go to a physician, we'll be questioned right, left, and center on why should we pick up a product which is not termed as successful elsewhere. And I think we prepared it very well. The insight generation, as they call, the real meaning of insight generation, we really did that in the cases of Brilanta, Crestor, Armidex, and those are the products. I think the tribute to the cross-functional team and tribute to the brand managers who also enjoyed this process, because many a times brand managers become so passionate and they become very defensive when there is a feedback, and they don't want to incorporate that. And the process, what happens, we miss some of the critical elements which can make a brand to succeed. I think I would, the learnings of MPH and the MEX, translating that into real execution with a cross-functional team, I think it made it. So, my launches always had every department to go to the market. Irrespective of what function you're doing, the leader had to be there in the market to see, because ultimately, if that asset succeeds, the organization succeeds. So you can't say that, hello, I'm in finance, I'm only responsible for money matters and not responsible for what happens to the brand. No, I never used to agree. I used to say a finance person has to go and experience it. HR person should go and feel what it means to launch a brand and how it can impact people. So it brought in a lot more responsibility and a lot more ownership across the organization. Otherwise, typically organizations are torn between sales, marketing, support functions, and blaming each other for failure or success of the product. I think that was broken, and we saw the impact of that.
So you, in a way, you're saying that you ensure that silos did not exist. Absolutely. And you ensured that there was a complete osmosis of processes and experiences, and obviously the building of the blocks for all the new product launches, right? And this was a critical success factor in your assessment. Okay, great. Once the other piece is that once you moved from marketing and you got into a role of business development, which again was a new dimension for you, because business development is all about licensing, in licensing, out licensing. And I saw that in your profile, you also were instrumental in getting the tie-up with BMS for Onglyza, etc., and getting it as a partnership, a collaboration deal. Now, my question is not so much about what you did with the Onglyza thing, but my question is, you seem to be a guy who moves seamlessly through roles, sales, marketing, as you said in the outset, whatever's thrown, I embraced it with open arms. That's true. But what is the mindset that goes behind that, Kumar? How is it? What is it that we can learn? It's not just being, okay, I embrace it. What made you do that? What does it take to, embrace such roles fearlessly is something that I want you to dwell upon for our marketeers and for our BU heads and every one of us. Yeah.
I think the first is, are your fundamentals strong? The self-confidence comes from the strong fundamentals. As I said, I've been very fortunate. I've worked under some brilliant bosses. I've copied them shamelessly. It's just that you admire and you try and imbibe some of those qualities. The analytical rigor and the self-confidence. I think the first is that fear of failure out. You got to take the failure as a learning ground. Sometimes you fail, it's all right, but you get drowned in failure sometimes. But you have to back yourself and say, I can do this role. If somebody has trusted you to do this role, that means there is something in you which makes somebody to. And that has been the case. When I was told that you were to become the head of marketing for North America, I had no prior experience of US market, and US market is completely different. The fundamentals are completely different. But here is somebody telling me you're going to become head of marketing for US. I said, there must be something. And I just have to go and do what I am doing all the time. Just go and do the job. Trust that you become a student again. Shamelessly, go and become a student. That's my principle, that I will go learn. I mean, I know that, and I'll make everybody feel this, that, I don't know everything.
Right.
And and that's the way I work. I don't know everything. So I seek help. I know certain things, but I seek help. And over a period of time, I know that I can become a subject matter expert. So it's about just ensuring you stay a student. You be a student, show that learning agility, show that adopting quality, and most important, bring that mindset. You can do it, and that has been the mantra, if you ask me.
Right. No, the 3 points that you have mentioned, I think for me and for my viewers, is don't have the fear of failure, as you so beautifully said. Second is be a student learner all your life. And third is be open to possibilities, right? And back yourself with confidence so that, you obviously take on that role with full intent and deliver. I think and these are soft things, but they have an impact on the outcome of how well you succeed in your roles. And thank you so much for elucidating that. I know your leadership style, but I still want to ask, your leadership style has been empowering subordinates, right? And giving them a lot of elbow room to innovate and experiment. Would that be right in saying so? And that's how you have built great brands and businesses and organizations wherever you have worked. Would that be a fair thing to say, Kumar? So I thought of asking.
So I'm known as the people man. I love, interacting with people, learning from people. And I love to have these small talks, on any subject. And when I'm working with some of my youngsters, I know that I can learn a lot of new things. As they say, you have to be relevant. And in order to be relevant, where is the best way to learn? You look at your Generation Z or whatever you call, there is so much of new learning, new awareness. They are impacted by the new learnings. So we need to learn from them. And I think people have always been told that, I can be very, very, very dogmatic in my arguments, but don't have the fear. You can challenge me and you can correct me. And I'm perfectly, for me, it's perfectly all right to be challenged. And I don't mind changing my opinion or whatever it is. Give me strong arguments. I'm just open for it. So people always, it's more than empowering. It was that, my door was open. And I will be part of the problem. It's never that, you're thrown in not being there. I was always very much there. I will be part of the discussion. As I said, it was like a servant leadership. I will be part of that, roll up my sleeves, work with them, ensure that they feel that confidence. Right. And you be with them all through, whether it's failure or success. You are there. If need be, you take the punches on your face. It's all right. But they should know that they have been backed all through. And I have full confidence in them. So when I see these things happening, and I think early in my career, I saw this happen and I have not changed. I just back people. Once I know the person has the right attitude and the mindset, and he has shown the learning agility, I've never gone by the conventional that he can be only a good marketer if he has come from marketing. He can be only good sales if he has come from sales. I've thrown people to different directions and I've never failed somehow. 90% of the time, people have found their way and they've become very successful.
Great. No, that's really nice. So backing and, trusting your instinct has also played a very big role. Thank you so much. I come to the, to the last part of our conversation. I have to respect your time. It being a Sunday morning, you have given us the time. I'm so much, deeply grateful to you, Kumar. Yours now is your run in Viatris, or formerly known as Mylan, right? You joined the organization in India as the head of the India commercial. Again, spectacular delivery of growth in terms of the specialty care franchises in hepatitis, in critical care, oncology. And what strikes me most is that Viatris or Mylan is not a typical big pharma traditional company like the Pfizers and the Novartis or the AZs of the world where you have worked. But it is a model business model is completely different, right? but yet they have been able to build some powerful brands across in India as well as in global. So how was your experience, in that new business model? How is it, what it took to scale up and do so well? I thought of asking you your experience in India before you moved to the US. Yeah.
Yeah, I consider pharma as a very fulfilling career because, I think no other have platform has the kind of impact it has on people's lives. You are treating people who are sick and who are suffering, and you are expecting them to, lead a better quality of life. And, we have always spoken about access, addressing affordability, ensuring medicine is available to the last man in the world. And Mylan gave me that opportunity to create the real meaning of access I saw in Mylan. Mylan as an organization had done brilliantly in HIV space. And when I was approached, I was also told that, the similar kind of approach they wanted to have in India at different diseases, whether it was hepatitis C, hepatitis B, whether it was oncology. I think, the real word of access, we know, how many people were touched by great treatment, but delivering to very few people, because we could never address the affordability issues for the organization which had its own constraints. It's not that they were not sensitive, but it had its own business constraints for not to do it. Now, here is the company which said, look, we will do what is best for that country, right? And the whole focus is about creating access, creating affordability to the world. They said, we want to impact the 6 billion people in the world. I thought that was a great value proposition. The second was, I always had this ambition to build a company from the scratch in India. I wanted to leave a mark where I wanted an organization which I would have loved to be part of, So I thought that was a value proposition. I just took it, And Mylan gave me that freedom to build an organization. It had all the best practices because it was an American organization, an organization which had like a massive portfolio of 800 products. It's not one or two, 800 products, right? And it had a manufacturing capability which nobody else ever had in India, with so many factories, and probably one of the biggest employer, unknown, but it was a huge investment in India from a US organization. So I was told by Mr. Malik, he wanted a great brand building company because we were becoming a front end for many companies who were entering India like Gilead. He wanted to ensure that I was a company which had the best of reputation in terms of whether it is ethical conduct or whether governance, etc. And he wanted to ensure that people love to be part of this organization. I think I could achieve all the three. We have made a great stride in the organization. We're probably one of the fastest growing company. Today, we have made a big difference in the area of hepatitis C, hepatitis B, oncology. And I think we also showed the world that we are capable of building a center of excellence of marketing for the entire world. So Mylan has been an organization which has, I would say, today when I look back, I think it meets all that aspirations I had. Finally, that you signed off and you ticked many boxes, right? And when physicians, when the breast cancer surgeons of India invited me as a guest speaker, as an industry guy, as a guest speaker, I think that said that I had made a difference, right?
A crowning moment, yeah.
And when the patients are called and said that you are so good and you made it affordable, this product would have never been there. When I launched meropenem at 250 rupees, it was unthinkable, right? A great medicine, very few people could afford. And here we changed the market against the market's forces and made it available. And that was the, fulfilling, I would call it, a dream where, I can look back in career and say that it was something I will always remember, having made a difference to people.
Amazing. That's really so nice to hear that, and what I loved is that your deep burning desire to build an organization from the scratch, as you said, with the fundamentals of integrity, the fundamentals of patient centricity, and with the, doing the things the right way with ethics and compliance. And those of us who have known you for 2.5 decades plus, Kumar, you know that these are values that you would not surrender even for a second, right? So, I mean, that's so much important for all generations of marketeers, right? And I had one question on the same subject, Kumar. You mentioned that the philosophy was cost optimization and compliance. You're stretching the dollar. But there is, so the two C's are fine. How about the third C, creativity and innovation? India is a hotbed of creativity, out of box thinking. Do you think that also can come from India, from the COE? Look at that.
Absolutely. They say our ability to think on our feet is a blessing for us.
Absolutely.
A very tough market. We work in very tough marketing conditions.
Yeah.
So it's sort of it also creates that opportunity for you to think innovatively. Problem solving comes very naturally.
Correct.
So it is, that's again is seen. Today I think the world recognizes that.
Yes.
And we know that it's not very easy to deliver a creative, innovative solution in pharma. It has to go under a lot of scrutiny. It has to meet all the compliance parts. Sometimes it is very frustrating. You have to go through a lot of approvals before it actually becomes a norm. But today we are seeing in technology, we are seeing India has tremendously evolved. I see a lot more technological intervention during COVID. It is much more, I think, high in terms of how it was leveraged in India than elsewhere, right? So I think there is a tremendous talent there for creativity and innovation. And I'm sure, Indian marketeers will have a great platform in the coming days. Because what COVID has also done is it has broken the boundaries. There is no more boundaries. You could work from anywhere and you could still deliver what the market requires. So I think if at all anything, the positive side of COVID is, one, it has accelerated transformation in pharma. Second, I think it has broken the boundary walls. Third, it has given people to look for solutions everywhere. And I think wherever the solution is coming from, irrespective of diversity, I think it will be lapped up.
Excellent. Last couple of questions, and this is something that is a must-have on my list because being a man with so much of rich and diverse experience, my first question is a little bit of crystal ball gazing. So I don't. I just wanted to ask this question because you're at a very vantage position in global headquarters, and working with various country markets in Viatris, including India. What do you see is the state of the future of pharma marketing now, especially for us in India or wherever as you feel comfortable? Because there's a lot of VUCA, there's a lot of uncertainty, there's a lot of fogginess around, and there's disruptions happening all around thanks to the Ukraine war, thanks to the global so-called recessions coming in. There is a stretch for the rupee, stretch for the, difficult in spending, consumer spending sentiments have gone down, but healthcare continues to be driving innovation. How do you see all this and make sense of it, Kumar, is what I thought of asking you. Yeah.
Interestingly, when the COVID hit, I ran a project here in US called Commercialization 2.0. And we sort of did a role evolution of different commercial roles in pharma. And we looked at what potentially will look in the future. As we say, the sales rep role has changed. Pharma marketeer role has changed. The way you interact with your customers have changed. The customer expectations have changed. So nobody expected this to happen. The COVID has really pushed every organization to look at changing the business model. Pharma is accused of, remaining in status quo for too long. We have done more of the same. But I think this has now pushed everybody, whether Novartis today launching something like what we call the Netflix model of, the HCP engagement is a reality. And I think if at all anything, pharma marketeers should see this as he's very lucky to be part of this transformation, yes. Right? And if you're there as a part of the transformation, it will create discomfort to us. There will be challenges, there will be frustration. but you are part of the transformation. And you just need to enjoy being part of the transformation. Be passionate that this transformation has huge benefits going forward, right? And it will have impact in many ways. Today, you look at the patient, I think the diagnosis has changed dramatically. The treatment approaches have changed. Even physicians are realizing that they can do practice in a different way. So the whole world is changing, right? So you don't worry too much about what is happening to you individually. While that is important, I think it's, as you said, it is being important to be in present. Just enjoy being there, enjoy that you are part of the transformation, and be passionate about also changing your own capabilities. I don't think I'm guided by this book. I'm a very passionate recommendation I do for everyone. What got you here won't get you there.
Right.
So true. Many a times we think that, oh, I was a successful sales manager, now I'm going to be a successful business unit head. No, I think you got to unlearn first, right? There's a lot of unlearning to do, but there is a lot more learning to do. So if you bring that mindset and say that thankfully I did something great and I'm here, but that's not relevant anymore. MHN always to recommend that you should spend at least 10% of your earning on learning something new, reading some new book, learning, having some, attending some talks here and there, playing a new game. I think it is so relevant. If you don't challenge yourself, I think you tend to stay where you are. And when you have that tendency, then you find that stress is the big factor because you are trying to resist the change.
Right.
My issue is never that, I just enjoy what I have to do. So why worry about if it's going to impact me, it is going to impact everyone else. So we are in it together to find solution. So just enjoy being there. But you got to invest. You got to invest in building your capabilities. You got to invest in learning something new, challenge yourself, and look for opportunities to execute those new thinkings.
Right.
Yeah, that's where I think the whole world is going to be.
Thank you. It's been a wonderful to the hour conversation with you, Kumar, and a deep sense of thank you and gratitude to you for having spent this hour with us, enlightening us with your well-earned wisdom and experience over the last 4 decades. And really, there's a lot of takeaways, for marketeers and business heads and directors who actually tune into these shows, right? So I'm sure there is something for everyone today to take away from your very rich career of, a career span, which was filled with a lot of learnings. Any parting words of wisdom before you sign out for our entire community of marketeers would be only apt, Kumar, if you like to say anything.
So the first thing I would say, Shailesh, this is a fantastic job what you are doing. I think
Thank you.
Very important for us who have been a beneficiary of this industry. When we started our career as a rep, I would have been delighted to become a regional manager. Maybe I would have said I achieved what I did. And today where we are is because of so many factors coming together, so many people conspiring to make you successful.
Yeah.
As I said, mentors. I cannot take away my family, my wife and children. They have gone through tremendous change. Like you said, 18 roles, 3 continents, moving job after job, school after school, house after house. My wife has shifted 25 houses in this. And you know how difficult it is. And their ability to adapt to the change and still make that things happen has inspired me, And I think we should see that, we are a product of so many people working on you, and we have to be thankful for that. So first thing I would say is I'm very happy to be a sounding board for anybody. Feel free to share my email ID or you can share my phone number. I'm very happy to be a sounding board. You want to have a small chat with me, you are in a career crisis, you want a guidance, you want to just have a talk with me, I would love to do it, because I believe ultimately I have to be a people's coach. I was a beneficiary of guidance of so many people, and I want to be that. So I'm very open for that, and I love to interact with people, and I like to learn from people. So my first offering is I'm open for any conversation. And I must tell you that we never had a pharma marketing textbook all our life. Recently, I came across one of the textbook published in UK by Professor Brian Smith. I don't know whether you had a chance to look at it. It's
Yes.
called brand therapy. So I think, you should, as a part of your curriculum, maybe it's worthwhile recommending a book, which is really a structured marketing book, and certainly it can help.
Yes.
And the third thing I would say is that, when you are in your path of your career building, don't worry about having a very particular path. I remember, long back I was told the meaning of luck. So many a times I call myself, I'm very lucky that I got all those roles. Very rarely you will see people done 19 roles in pharma over 40 years, every second, third year. But I was told by my big boss at that time, he told me his definition of luck was a junction between hard work and opportunity, right? So you got to do your work in the most diligent manner. You got to put in your hard work. And as the opportunities keep coming, there will be a junction where both these things will meet. And people keep watching you. You are part of that. People watch you. When you're a talent, people watch you. And people are very passionate about getting the talent, create an impact to the organization. So you got to keep going, relentless learning, relentless effort will take you there. Do what is in your control. Don't worry so much about what is not in your control. Right. Many times, certain promotions pass, it will not happen. Certain grades may not come, but that's not the end of the world. I think there is always a next time, and you have to just keep going. So that's all I can say from my own perspective. It's all about being relevant, and it's all about keeping that smile going.
As I said, thank you so much once again, Kumar, for spending this time. And it's been wonderful, absolutely wonderful interacting with you. I will only sign off by saying like how we manage, you manage life cycles of brands very successfully. You have managed your own life cycle very, very well. And it would not be an understatement to say that you've been a brand in your own self. For many people in the Indian pharma industry who have looked up to you, worked with you and under you. So you have led a career which has been very fulfilling, which has been outstanding, not only in India, but also in a global scenario. So thanks once again for being a part of our platform, sharing your learnings, your collective wisdom. Deeply grateful to you, and look forward to staying connected with you, and look forward to you coming back on our series at some point of time again with a new dimension, with a new perspectives. Thank you so much, Kumar.
Sincerely, thank you. Thank you very much.